So this is MSC and PRP and BMAC for the PT ASAP. So there's a little bit of a problem with the whole stem cell world, in that there's a lot of these abbreviations like PDGF, VEGF, EGF, FGF. So these are all growth factors. And orthopedic surgeons aren't the brightest lot in the world, and even we don't understand what all of this stuff is. So the talk, every PT needs to understand the function of every growth factor responsible for healing. So let's get started. You need to understand this today. So just kidding, right? I can, just by showing that slide, everybody like checked out. So, oh no, I hope my videos work today. That sucks. That video was supposed to happen. Oof. All right. So my videos aren't working, but that's, yeah, we'll figure it out again. So this just goes to kind of how I started the talk. The patient awareness of this is high, right? We're in the internet age, and everybody knows about stem cells. I have patients now that are coming in asking for stem cell treatments. And I'm like, do you even know what's wrong with you? Nope, but I want some stem cells, right? You are undoubtedly going to see athletes and their parents who will be offered stem cell treatments. There's going to be a lot of not sports medicine practitioners who are going to influence your care of your patients despite your recommendations. You may be able to figure out what's wrong and why they have anterior knee pain. They're still going to go get a stem cell shot because it's a quick fix, and that's what our society wants these days. Plus, I'm sort of a little biased in thinking that our current generation of patients do not tolerate pain as well as prior generations. So the wuss factor is real, I think. But it's also important to note that I also think on the other end of society that there's a lot more of a movement for higher activity levels later in life. Older than 50, in a sports practice we're seeing a lot more of the baby boomer generation is still trying to get it done. And so they're not happy with an arthritic knee that's limiting their ability to hike or ski or play tennis or golf or anything even later in life. There's a waning interest in arthroplasty, which is what we just talked about. Anything but a total knee. And they'll do almost anything. And then there's sort of, painting surgeons as the bad guys, right? And some of that's warranted because you have a little bit of arthritis in your knee, you take it to 10 orthopedic surgeons, 9 of them will sign you up for a knee replacement. So just be a little bit careful about these trends. Regenerative medicine is a confusing space. Orthopedic surgeons have been really slow to embrace this technology. As I mentioned, chiropractors, pain management physicians, other holistic healers are way better at marketing than we are. And just in 2018, 1,000 new stem cell clinics opened in the United States despite the risk of being closed down by the FDA. So they don't care about that, right? They can make enough money before they get closed down to make it a good business venture. I think that, again, the patients are responding to marketing. They're responding to advertisements, lots of free meals to come learn about stem cell therapy. And they're making us the enemy. And then I think the biggest problem and the thing that we're going to try to remedy is that the people that are doing this are practicing in a non-evidence-based way. They don't have data. They don't understand what all those growth factors do. And yet they're injecting this stuff into people anyway. And then finally, I think the problem is, what if it doesn't work? If you have a non-surgical practitioner or sort of maybe a holistic person, if the stem cell injections don't work, the answer is, well, sorry, you spent all that money, go see a surgeon now, right? So they don't have alternatives if it doesn't work for them. So today's talk is just going to be to understand the basics of how these stem cell injections are prepared and understand what works and what doesn't. We're not going to go into the science, thank God. And I'm just going to kind of show you what I've gone through in the last 5 years to figure out what I think has potential and what actually has evidence, and the stuff that I'm doing in my practice. And you guys can judge for yourself whether you think that those are the viable products. So 2 categories, right? Autologous cells. So the 3 main stem cell treatments that you can get from yourself are fat, bone marrow from your hip, and platelet-rich plasma from your blood. The PRP is not truly a stem cell treatment. There's no stem cells in your blood, but we'll talk about that when we get to that section. Then there's allogenic stem cells. We can get them from placental tissue, the amnion. We can get umbilical cord blood, or we can get umbilical cord tissue. And these are sources of stem cells from another person. So let's talk about fat first. There's high concentrations of stem cells and tissue repair elements in fat. And I have a video on here of Dr. Kaplan talking about that. That's probably not going to work today. So we'll talk about that. There's 100 to 500 times more reparative cells found in the same equivalent of fat as there is in bone marrow. The reason we started with bone marrow is because of little leukemia kids, right? So kids who have leukemia would get a bone marrow transplant. They dig the bone marrow out of their hip and then grow it up in culture and then kill all their cancerous bone marrow and then re-inject the bone marrow. And so that was the source of stem cells and always been the source of stem cells. Turns out what I'm going to teach you today is there's not very many mesenchymal stem cells in your hip bone. There's a lot of hematopoietic stem cells, which means that grows all the blood cells, which is great for a leukemia kid. It doesn't grow cartilage, bone, ligament, muscle. So we'll go over that in some detail. But the big thing about fat is that nobody wants a trocar driven into their pelvis, but everybody's okay donating some fat, right? Everybody's okay giving up some of their success, right? So if you look at fat, fat contains 2% nucleated stem cells. So what that means is that if you take enough fat, you don't have to expand the cell line. And that actually gets important because we'll talk a little bit about how the FDA is restricting our ability to expand cells outside the body. These terms right here, CFUF, that stands for colony forming units fibroblast. And that's a way of figuring out how many stem cells you have in a quantity of something. Okay, so this is just the way that you figure out how many cells there are. Bone marrow has 10 to 58 CFUs. Fat has 2058 to 9650 CFUs per 1 cc of tissue. So way more in fat than in bone marrow. We're going to get to this in a second, but this SVF thing in the middle stands for stromal vascular fraction. And if you prepare fat appropriately, you can get the little thing in the plug in the bottom of that tube has all the stem cells and all the nucleated cells in it. You throw away the rest of it. So what we want is that stromal vascular fraction because that has all the good cells in it. So here's the data where we got those numbers on the colony forming units. But it also has a couple interesting other subsections, and we'll get back to this slide later. Look how many stem cells there are in your blood. 0, right? Look how many stem cells there are in umbilical cord blood, 0.06, right? So we talked about that as a source of stem cell. A bunch of folks will come into your office and say they had an umbilical cord blood injection. No stem cells. The bone marrow aspirate, as we talked about, much less than fat. So we're liking the numbers in the fat. And I'll tell you why this actually doesn't work very well in a second. So Arnold Kaplan is the father of the MSC, mesenchymal stem cell. Now remember, mesenchymal stem cells make connective tissue, not hematopoietic stem cells, which make blood. Okay? So we don't care about the blood. We care about bone, cartilage, muscle, bone marrow, ligament, fat, and other connective tissue. He made this slide, I think back in the early 80s, that show how you can take one stem cell and it can differentiate down different lines into any of the tissue that you need. And somehow it's smart enough to figure out where it is and what environment it's in and which lineage it needs to go down, which is amazing, right? And I don't think anybody understands how that happens. So this is the key slide that made him kind of the father of all of this. So the newest data, and again, this is from Kaplan, the newest data states that mesenchymal stem cells originate from perivascular cells that are on the surface of the capillaries in the fat. It's very highly concentrated in the fat due to the large number of vessels. So we don't really care about the fat part of fat, right? What we care about is tissue in the body that has a ton of capillaries. So fat has a ton of capillaries. And I skipped over the top, or that slide last time where the dermis, the skin, ton of capillaries, right? And that makes a lot of sense because if you cut your finger with a steak knife and it bleeds into that cut, then you end up with a little clot which turns into a scab, which turns into a scar, which eventually turns into skin. And the reason, and then pretty soon you're like, I know like 10 years ago I cut one of these fingers with a steak knife, but I can't even see where the cut was. You can't even remember which finger you cut. Well, why does that happen and we can't get cartilage to heal in the knee? It's because the dermis has a ton of capillaries and that are all surrounded by these little stem cells. And there's a ton of stem cells in the skin and there's a ton of stem cells in the fat because there's a ton of capillaries there, if that makes any sense. And if you look closely at this micrograph, the cells are here. They sit here. Here's the nucleus, and here is the little cell that sits on the edge of the vessel. Here's blood, and this is the capillary wall. So that little guy is a stem cell. And you got to extract that from your